let's talk about what we're going to do here. We're going to do a flexor tenotomy. A flexor tenotomy is a release of the tendon on the bottom of this toe, in that this toe is curling down really hard. It is flexible, so if you look at a side view, you see I can straighten it out. All right, it's not rigid. We get callus formation and pain on the tip of the toe because as we walk, this toe hammers into the ground or sometimes mallets into the ground and creates a callus and pain here. We release the tendon on the bottom, this is the flexor tenotomy longus tendon, and I'm going to do a technique where I come in through the side with an 18 gauge needle to do this versus using a 15 blade and cutting the whole bottom of the foot. So we're going to see, we already put lidocaine in here, we're numb, we don't feel that. Okay. And I like to put that right there. And the 18 gauge needle has a blade on the end. And so what I'm going to ask is if we go ahead and just curl our toes down, right, like that. He's curling down. If we listen really close here, coming through the side, if we curl really hard. There we go. You can hear it. And if we get it just right and we don't hit any structures, we get very little bleeding. And then I'll curl one more time really hard down. There you go. So that's it, a Band-Aid. And I like to just put a little Band-Aid on this. But now that toe has been released, and so now when he walks, he curls his toes down. If you curl them down really hard, you see that one doesn't have the same pulling power. And this is a great procedure for these flexible hammer toes that are rigid. The tendon may or may not actually grow back, but at this age it doesn't matter. It won't affect the way he walks or runs. Okay. Beautiful.
Good.